Hi, I'm Teresa Baglietto, host of In Shock Radio. Like many of you, I have faced my share of challenges. From cancer to job loss, divorce to financial hardship, you name it, I have experienced it. This podcast is about overcoming life's toughest moments and finding the courage and strength to keep going. So tune in to unleash your inner strength and discover how to move forward, no matter what life throws your way. Hi, everyone, and welcome to the show. I am so honored to have this very special guest join us today. It's personal for me, given how many times I've been diagnosed with cancer. Joining me is Dr. Manuela Kogan. She's a clinical professor and integrative medicine internist with both training and experience in internal medicine, psychiatry, and integrative medicine at Stanford. She has helped hundreds of people learn how to calm their nervous system when they've been diagnosed with cancer. Her work primarily centers on guiding patients through the emotional and physical impact of having your world turned upside down when you've been diagnosed with cancer. She's the author of When Cancer Visits and How to Free Your Mind from the Grip of Distress. It's a book that will give you practical tools to help you steady your thoughts, calm your nervous system and your emotions, and reconnect with your body. Today, we're diving into some breathing techniques and exercises Dr. Kogan uses with her patients to help them calm their nervous system. Because when you're facing cancer, having a clear and steady mindset makes all the difference when you're making difficult decisions about treatment and surgical options. These techniques can help you reduce your fear, the numbness and shock that often gets in the way of thinking clearly when you've been diagnosed with cancer. I have personally tried many of these exercises, and I can honestly say they work. They shift your focus, quiet the noise, and create a sense of grounding. You can think of them as a gentle way to redirect your attention when everything feels overwhelming. So let's dive in. Dr. Kogan, I read your book, When Cancer Visits. It was an incredible read. So much of it was relatable to me, especially having cancer 4 different times. In the book, you mentioned that the shock of cancer jolts you into a different universe, and I can certainly attest to that. I remember the shock and the numbness with each and every one of my diagnoses, including the emotional aftermath that comes with it. What really resonated was your approach to cancer, not just a medical condition, but you talk about the effects to the entire system, our thoughts, our emotions, and our body. Was there a moment, or maybe it was a patient story, that made it really clear to you how cancer can distress someone's nervous system?
I mean, it was an evolution. I have a meandering path of education of being originally trained mostly about the brain, but then I also did an internal medicine residency, and I realized that you can't separate the mind from the body, the heart, or the lung. These are unified, as I say, in When Cancer Visits, a conglomerate of cells, a heap of cells.
Mm-hmm.
And once I realized that we need to treat the whole system, not just the important actions of how to treat the cells that have cancer, but what are we going to do with the other cells, the cells that emote, or the cells that think, or the cells that are scared, or the cells that tell stories, because
Mm-hmm.
they're limiting our ability to really make good choices. It was very interesting. I vividly remember having a conversation with someone where I would, and this was years ago, I would say something and they would take a breath. And I thought that was odd, like, so words come out of my mouth and I would see almost a sigh. It was very kind of not jarring is not the right word, but I remembered the curiosity of what had happened. Why would words come out of my mouth and there was a very clear response from body?
Mhm.
And I later noticed that it was usually when the words matched the patient's experience. So I became really curious about how the body expresses itself when reality is spoken that the mind might not agree with. The person
Mhm.
might sit there and say, "Oh, we're doing this and this and this and this," and the lung independently would take breath. And so I realized the importance of integrating the system, this nervous system that gets jolted. Your podcast has a very clever name, In Shock, and it's the nervous system in shock.
Yes.
And then I was really intrigued, not just to help the mind in its thinking with cancer, but help the body, help the mind. And then I became a little obsessed and excited about it. Like just,
Yeah,
um,
I can imagine. I used to joke with my friends because I went through a lot of stuff in what felt like a very short period of time. And I used to say, my body and my brain are not attached
mhm,
because my brain wants to get going and moving and
mhm,
doing and continue
mhm,
on with life. And my body is just taking one hit after the next. Like it's
mhm,
not the same vessel. That's how it felt.
mhm. And there's definitely this coordination between those entities. So view myself as someone because I understand mind, I'm trained in mind and brain, but I'm also trained in heart and lung to kind of bring that system together in a as holistic approach as possible. And really with the goal when you are in shock, you
Mm,
have to make important decisions. It doesn't even have to be cancer. I talked earlier with someone who has MS, and you have important decisions to make. And when the jolted nervous system, as I say, and when cancer visits, affects that decision making. So when cancer visits, it's not about what chemo to use or what radiation to use. It's
that's
clear
right.
that you have to make important choices, but be at your best in body and mind when you make those choices.
Yeah.
That's kind of the purpose of the book.
I liked the grounding techniques. You had some very specific breathing exercises. And when I was reading the book, you use visualization for words, even writing the word in the air and the breathing techniques. When I wrote joy in the air and I was breathing in between each letter, I was even more relaxed than I was before I started this practice. I'd love to know how you determine that as a solvent for the fear and shock and uncertainty that we all have when we have cancer.
Yeah, so it's based on the physiology of body and mind and how they interact. The brain has limited processing capacity. So if the mind tells the heart, "Hey, don't palpitate, slow down." The heart says, "No, thank you. I'm beating because it's scary." So boom, 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 boom. You
Right.
talk about in one of your podcasts, I think, about the chest pressure. And so the mind doesn't have the ability to tell the heart, slow down when it's scared.
Mm,
But the brain, the mind can slow down when you slow down the heart and help the lung breathe. It's a very simple mechanism.
mm,
The vagus nerve, again, when people read when cancer visits, I go into the physiology of the information that gets from the lung and the heart to the
mhm,
brain through the vagus nerve. A lot of fibers where the brain doesn't have a choice. The mind has to then kind of go along with the program. However, if you have a very active thought process, particularly one that projects into the future. Oh my goodness, am I going to live? Or is the radiation working? Or this fear
mhm,
based thought about the future, it doesn't overrule or it can overrule what you do in your body. So you have the mind, You keep the mind busy with something that basically cracks the capacity of the mind to process information. Very
Mhm.
simplistically, looking at it simplistically, the brain is like a complicated computer, and you can crash the network with information, but let's crash it with pleasant information
Mhm.
like visualization or auditory stimulation, music, kinesthetic. I'm walking through all senses that you can use to shift focus away from what the brain does under fear, which is thinking not super helpful thoughts.
That's right. When we first get diagnosed, we don't have all the information, right? It's
Mhm,
just you've had a biopsy or some test that's revealing you have cancer. And I remember when I got the call, I immediately put myself 6 feet under because it was
mhm,
like, oh my God, I
mhm,
have cancer. I'm going to die. This was in 2013. A lot of people were thriving through cancer at that point, and chemotherapy was very different. Wasn't that scary stuff that was even 10 years prior to that. But nonetheless, when the news came, I was like, "Oh my god, we gotta start planning my funeral." And looking back, I didn't have any information other than, "You've
mhm,
been diagnosed, now we have to run all these other tests to determine
mhm,
what's really going on with you." I'm sure everyone has a very similar reaction.
mhm. And that's exactly, and I'm very glad you're mentioning that the mind gets tripped up with the word cancer. We
Yeah.
live in a society where it used to be true that cancer equates usually to death. That is
Mm,
not true anymore because
mhm.
cancer is like, I don't know, hundreds of illnesses that cover the whole range from things that can be cured to things that you have to live with
Mhm.
or might eventually die. But when people hear the word cancer, the mind makes the association you made. It's cancer equates death, even when that's not true.
That's
So
right.
a fully functional mind would say, hey, Teresa, let's collect information before we tell a story about the future, which is only based on fear. Of course, you
Right.
tell yourself the story cancer equates death because you're scared and in shock.
Mm.
And that was really motivating for me to write when cancer visits is how can you be better friends with your mind? The mind is superb about writing poetry and it's superb about designing how to build bridges, but
Mhm.
it's not that useful in the space of uncertainty.
Mhm.
When things are uncertain and a cancer diagnosis is uncertain, then the mind starts telling stories. In your situation, it told the story of death.
Mhm.
But obviously, it wasn't based in the reality because it is now 12 years later and we're having a conversation.
Yeah. I had breast cancer twice. I had cancer on my lip and I had melanoma on my back. The breast reoccurrence felt different when the diagnosis was validated because I had felt something. It was when I went through treatment that I became extremely scared because I thought, what if this doesn't do it? You are working with people who are terrified and uncertain and overwhelmed. And sometimes that emotional weight can be much heavier than the original diagnosis. The thought of a recurrence
Mm.
can really trip you up. And I would say I fall into that bucket still today. When I go to the doctors for anything, I'm like, okay, is this going to be the day?
Yeah, and there again, it's human. I sometimes only half jokingly said a dog wouldn't do what humans do. So if the dog loses a leg, it's going to hobble around on three legs. It doesn't think about how it lost the leg, and it won't
Mm,
think about the fact that it might lose another leg. Humans, they are very busy thinking about how it happened. Were they somehow, was it their fault? Did they eat the wrong thing? Did they live someplace where there were chemicals? Was it too much stress? So they are mentally very engaged in the past of how, to use the dog's example, how they lost the leg. But then even
mm,
worse, what you just demonstrated is they're thinking about, oh, this could come back and it'll kill me the next time. And again, from a human nervous system perspective, that's very normal. But I want people in that situation to behave more like a dog, because if you do think about it's coming back or how it's my fault, or attribute if I now drink too much wine or do this or that, then it's really my fault when it comes back. All these causality associations that we don't
Mhm.
know about, you're not helping yourself. You're really stressing the system.
Right.
So, how can we help the mind to not engage in something to that extent that doesn't help your illness, it doesn't help your treatment, it doesn't help your nerves, but it does something that humans unfortunately, but sometimes do. It's called cognitive closure. The mind wants the story to end. The mind wants to create a story that has a beginning and a middle and an end. And it will tell that story not based on the reality of what happens in the heap of cells.
Mm.
Again, to use the image I'm using in When Cancer Visits. And so that's a very difficult tightrope to walk. You need your
Mhm.
mind to make good treatment choices, and maybe sometimes you have to prepare for the future, or you want to optimize the future. You want to shift your odds. One chemo might be better than the other, or one preventive treatment might be more protective than the other. But at the end, whatever the mind presents in the story is usually based on fear and storytelling, and not on the reality of yourselves.
Yes,
Um,
I would agree with that. There's an section where you talk about changing your focus, and we all get distracted whether you're going through something big or not. You have some exercises around focus. As soon as I read the chapter about reoccurrence, my heart rate went up. I was like, oh my God, I'm that person. I'm reading about myself right now.
Mhm.
And the exercises around focus I thought were really helpful. Can you share that with our listeners on what is that?
Yeah, it's all an attempt at helping the system, including the nervous system and the mind and the heart, to be in the best possible state to handle adversity. The examples we give or you're talking about, they're all about adversity. And now with adversity, since we're not dogs, we have to we do focus on the past, and we focus on the future to somehow appease this mind. That's often not very helpful.
Mhm.
And as I said, the brain has limited processing capacity since it is a complicated computer. So instead of focusing on what happened when you read the chapter about how do I deal with recurrence, it was almost like, I'm feeling that the fear of having that, because your
Yeah.
mind engaged with an example in the future that could happen,
Mhm.
but you don't want it to happen. So you
Correct.
don't know if it's going to happen.
Right.
And so it's very activating to then think about. But if you shift your focus on an activity that engages the brain in a different way, while you're helping the nervous system to calm down, the brain can think about how you're going to die from that recurrence that you might or might not have.
Right.
And so it's only using the brain's limitations to your advantage. And that's really what's really helpful about, in some ways, the simplicity of the system of the lung and the heart. They know how to coordinate, they know how to be in sync with each other, and they can really help the mind put a little distance from these very fearful thoughts, particularly when you engage it with other senses.
Mhm.
Thought is just one capacity of brain, but visualization, or the imagination of visualization, or the imagination of sound or experiencing sound. I don't think I talk about it in When Cancer Visits. If you listen to binaural beats, for example, while you're breathing, it's very confusing to the brain to have two different sounds go into two different ears that then it decides what kind of sounds are that, and I can't separate them, but it's relaxing when I breathe, and it's
Mm.
impossible to think about a recurrence. So it's really using the brain's limitations to your advantage.
Yeah, that makes sense. It probably requires some practice, right? I found what was really effective was writing the word. Like,
Mhm,
what is your word? What are you feeling? What are you thinking? Or how do you want to feel right now? And my word was joy. Now write it in the air. You're really engaging your brain
mhm,
because you're like, okay, am I going to do cursive? Am I going to just do
mhm,
script and then
mhm,
breathe in between?
mhm,
There was a
mhm,
lot of thought process that went into it. It didn't take me that long to do, but just for people who are listening, as you described that in the book, and I practiced this breathing exercise, it really was effective. It must be because you literally have to think about
mhm.
these different things that you're doing.
There's a complexity to it, but it makes physiologically and logically sense. I want to make sure that people don't hear just breathe and relax and everything will be good. It's
Right.
not about that. It's to put yourself in a state so you can then make difficult decisions. The
Mm.
other thing that the mind has a hard time with is you make decisions based on not knowing. So when you talked about yourself, it's like, so you're going for a surveillance test
Mhm.
and you might or might not have cancer. And then you're told if you take medication X, it lowers your risk, but you could still get a recurrence. So here you're taking a medication, you're having side effects, and it's an important thing to take because it lowers your risk sometimes quite massively of getting that recurrence. But God forbid you're one of the few people who takes the medications, has all the side effects, and still get the recurrence.
Right,
And
which
that's
was my case. Another part of the book I loved is you talked about individualized treatment, and we're not
Mhm,
quite there yet, right? Treatment is designed for the masses. You talk about be thoughtful about the treatment plan that you choose and really understand what those side effects are. And we don't know if we're going to have side effects
mhm,
because we don't know how our body's going to react. But mine was very unhappy with the drug therapy that I went on, so much so that I experienced 3 minor strokes, some brain aneurysms, some liver failure. It was very scary because here I am trying to keep myself alive and
mhm,
cancer free. And to your point, not only did all that other stuff happen, but unfortunately, I did have a recurrence for
mhm.
breast cancer. But I wonder, will there ever be individualized treatment?
Yeah, I mean, just think of the 9 billion people on Earth with very different physiologies, different ethnicities, different genetic makeup. And the research standard now is for various reasons see what works best for the biggest amount of people.
Mhm.
While also, I mean, more and more we have genetic tests and we can look at probabilities of cancer specific drugs working better on some genetic profiles than others, but that will never cover every individual need of 9 billion people on Earth at this point for various reasons. It's
Right.
very expensive.
Yeah.
It's also not possible to find a solution for everybody. So
Mm.
it's a combination of having in mind as a patient, patient, am signing up for something that works for a big proportion of people. Otherwise, it wouldn't be available, but I might be the person for whom it doesn't work. And what do I do then? And that's
Right.
also a scary situation to be in. But it is true that more and more you can then look at the people who don't fit in that group and see, hey, do we have something for you? I mean, there was a
Mhm.
very sad article about Tatiana Schlossberg, JFK's granddaughter who has an aggressive form of leukemia.
Mhm.
And the way she described, she has resources to find a solution for her personally. And her physician was very dedicated to literally go all over the world and talk with colleagues about how to specifically help her because she has unusual mutation that has a high risk for this cancer to be aggressive. But I
Mhm.
think on a range for the vast majority of people, that is not possible because they don't have the resources or the healthcare or
Exactly.
um,
Yeah.
but there is a trend wanting to individualize it.
You talked about energy in the book, and something that I also leaned into acupuncture.
Mhm,
And I was having trouble breathing after the bilateral mastectomy. She also was performing cupping on my
mhm.
back. The acupuncture was huge for me. I didn't realize how much that changed the energy in my body.
Yeah, I mean, in general, the approaches that we now call holistic, it used to be called alternative, and that's not a very good word because it's not an alternative to conventional treatment. It's an addition. Then they started using the word complementary, but that's not really
Right.
fair either because for some people it's the main treatment, and so now we call it holistic, and that is along the lines of really treating the whole of all these cells with
Mhm.
what is available to you. And there are traditions like China or India or also Europe that have been using things for century, millennia, that have a good track record, but are hard to study. And so, in the conventional paradigm of needing a control group to see, hey, we're sticking needles in your foot, and is it helping? What would be the control group of not sticking needles in your foot? People would know that I'm not getting acupuncture. The
Mhm.
research design for these holistic approaches are difficult to meet the standards of our Western design of quality control. But I'm all for trial and error as long as you don't hurt yourself.
Right.
Some people do things on both ends of the spectrum, natural or not natural, that comes at a price. And you just need to be cognizant about the price. There's an upside of what you're doing, but it often comes with a downside.
Sure. Yeah. At what point do patients come to see you typically?
Yeah, it's kind of a collaborative effort. I am closely connected to oncologists or radiation oncologists, surgeons, less so, more so oncologists and radiation oncologists that just know what I do. And so it's
Mhm.
a relationship that at this point, decades old. And it's a wonderful collaboration of saying, hey, we're doing these more mechanistic things. Can you keep their nervous system calm so what we're doing on the radiation end or the oncology end can be as effective as possible? So they know,
Mhm.
and it's kind of word of mouth. And it's also become more obvious that when people are agitated, that they might say no to treatments that might be helpful to them or say yes to treatments that are actually not helpful to them based on this activation of their fear. So my job is to kind of do the dial down of the nervous system. So the oncologist and the surgeon and the radiation oncologist can do their job.
Yeah, your mind has to be in the right place to be able to
Mhm,
make those decisions. They always say, don't make any big decisions right
mhm,
now because you aren't thinking clearly. I invited a lot of my friends to the army of appointments that I had because of the rapid heart rate in those appointments. And
mhm,
just even learning things at every single doctor's appointment gives you solace in some of it, anxiety in others, because now it's getting closer to you've got to make that
mhm,
big decision. For me, do you want to take a little bite out of your breast? The recommendation is to remove both breasts since my grandmother had breast cancer. So it was
mhm,
good to have friends there
mhm,
who were thinking more logically and could
mhm,
help me evaluate these different
mhm.
options. but I could have benefited from your approach to calm the nervous system.
And I always tell people also to record it. So it's definitely good to take listening ears. And in addition to the listening ears, most physicians are okay these days if you say, hey, I can't process what you're telling me. So are you okay with me recording? And then you go home and listen to it.
Great idea.
Yeah, I've been the listening ears for family or friends. And I'm often surprised that even though I'm a physician, that if I listen to the tape afterwards, I hear things that I didn't hear, and I'm not even the one who is sick. So to have listening ears, have a scribe or record it and then really say, did they say that? I mean, it's so much information to
It is.
process. You're not supposed to process it in a state of fear, but how can you? It's scary information, and the burden of the decision often is on you in terms of, yeah, we're giving you this risk assessment. If you do this, then your probability of living for 10 years is X amount. And if we do this, it's this.
Right.
They don't tell you what to do. They give you the odds and the pros and the cons. And then the burden of the decision is on you. And that's heavy because you want to make the right decision.
Mhm.
You want to live as long as possible with the best quality of life. You want quantity of life and quality of life.
Exactly.
And
I like that. That's a brilliant idea. I don't know why I didn't think of that at the time, but it's true. I remember when I had this strange thing on my lip and they discovered it was cancer. I got the call when I was driving down the freeway.
mm,
It was my very first diagnosis. After she said those words, I literally couldn't hear anything else she talked about.
mhm,
I'm
mhm,
thinking, should I pull over? Oh my God, am I going to get
mhm,
in an accident? What's going to
mhm,
happen? Even when she said, is this a good time? I'm like, yeah, it's a great time. What do you
mhm,
got?
mhm.
Not expecting that. I heard nothing after that.
Yeah, and so that is exactly the disconnect between the mind in a body in shock. So
Yeah.
when the body and the nervous system is in shock because it's dangerous, the information is dangerous, the
Yeah.
mind turns off. And so, yes, please do pull over. Yes, sometimes people still have the automated skill of driving because they don't have, you can still drive if you have scary information. But
Right.
since there is a disconnect between, it literally separates. You can
Mm.
even look at the brain in an MRI. In that moment of shock, the fibers that go to the part of the brain that has executive functioning and saying, hey, Teresa or Manuela, let's do this, they're not there. It literally disconnects. And so people need to know
Wow.
in a state of shock,
Yeah.
their mind very often or usually, not always, but usually doesn't work. And you have
Mm-hmm.
to make accommodations for that.
Yeah.
And people always think they can kind of control their mind with their mind or control their body with their mind. And it's simply not true. You can sometimes do that, or you can learn to do that, but the natural mechanism with shock, with adversity, is cognition glazes over.
Mm-hmm.
It's a fear response.
You're out of Stanford?
Yeah, that's part of
Mm.
my academic appointment is there, my clinic work. Yeah, in part.
So that it would be oncology, the surgeons who are involved in that patient's case who would then say, we could use you to bring some calmness to this individual. That's really where you get brought in as part of a treatment.
Yeah, I mean, people say, what do you do? I sometimes say I'm a body mind self regulation assistant.
Okay.
Because the nervous system is so activated that the mind doesn't work. You just gave the example when you got your diagnosis. It
Yeah.
literally disconnects.
Yeah.
And so, how can you learn in a time of adversity to utilize this nervous system and the lung and the heart, which are all very closely linked, and other mind capacities,
Mm.
writing in the ear, to get the system into a state where it can then tell the surgeon, oh, this is a good idea. I want to do X, Y, and Z, and not sit there frozen, leave, and then turn around and say, I have no idea what the guy said.
Yeah, because we go numb.
Mm-hmm.
Yeah.
Because your brain glazed over.
Yeah.
So I just try to assist in part of the puzzle, that doesn't involve a knife, or it doesn't involve a radiation beam, or it doesn't involve medication. And there are so many things. I mean, hypnosis, guided imagery, I mentioned binaural beats. There's so many ways to help the nervous system into a state so you can talk with your team, or also what you mentioned, be less scared of the future.
Mm-hmm.
The mind tends to tell stories about the future instead of saying, I don't know what the future brings. The human
Right.
mind literally is not good at not fabricating stories about the future.
Yeah, it's a tricky thing. I had a lot of radiation because the cancer the second time was all over the chest wall. At the end of it, I surprised myself and I was very upset. I was in traumatic tears.
Mhm.
And the radiologist at the time clearly had seen this before and said, "What's going on?" And it was, "Oh my God, how do we know this isn't going to come back? We're done with treatment. Now what? I've been
Mhm.
living this for 3 solid months, but there was this gigantic fear that I never expected until she said, "You're done and you get to ring the bell." And I was like, "That sounds awful."
Yeah, yeah,
No
yeah.
one's protecting me anymore,
Mhm.
right?
And I'm glad you mentioned that, because during treatment, people often feel like they're doing something, they're
Yeah.
taking action, they're doing something, to get rid of the cells they don't want in their system.
Right.
But then when you're in the surveillance phase afterwards, it's like you're not actively doing something to not have cancer cells in your system. I mean, unless you're on some maintenance therapy,
Right.
which particularly with breast cancer is very common these days, depending on what kind of cancer, what stage.
Right.
Yeah, again, I want to remind people that it is a broad range. Cancer is literally hundreds of illnesses, some of which are curable and some of which are unfortunately not curable and might kill you. And that is a very difficult space to navigate, because
Mm,
you don't know which one you are going to be at the beginning. So your
mhm.
mind might go to, I'm probably on the devastating end, which would happen to you.
Right.
But sometimes people also go on the opposite side, say, oh, everything will be fine, when things won't be fine.
Right.
So it's a tricky space to navigate, but I want to encourage everybody to make their mind their friend and not their enemy. Allow the body, what I said, this curious experience of saying something and noticing that a person relaxes into a sentence when it meets their experience or a desire. I talk in When Cancer Visits in a particular chapter how to optimize your needs. Your needs might totally change. Maybe you were someone who was always super excited about hanging out with friends, and you are an extrovert and you're social, and all of a sudden it's not true. And you're on the opposite end of the spectrum. And then everybody goes, what's wrong with you? Oh, you used to hang out and now you don't. And you're like, I don't know. This reorientation in this different world can also be very identity challenging.
Sure.
And so there's a lot that goes on in that space. Be collaborative with your team, be honest with what happens to you if you feel a huge amount of stress. These days, most oncologists and radiation oncologists and surgeons know, like what you described with your chest wall recurrence, they know. And so that's where I come in. I laughingly say When Cancer Visits that people say, go see Kogan. And they show up is like, why am I here? I'm like, well, someone told you go see Kogan.
Because you have a visitor and we're going to
Yeah,
talk about it.
exactly.
Yeah.
Well, and I want to remind people, the approach of having, being a heap of cells. The minority of your cells are cancer cells, even if you have metastatic illness. So
Mm.
please remember that you have billions of cells that need your attention and want to stay healthy and can help you with other functions. People tend to focus on cancer cells. Vast majority of your cells are perfectly healthy and they want to function. So help them to function.
That's great. If someone is just being diagnosed or going through this for the first time, what's something that you would want them to know?
Be as kind as possible to yourself and use as few shoulds, no shoulds in the space of cancer. I always say, focus on what you can do and what you want to do, sometimes must do. You still need to pay your rent, but don't say,
Yeah.
oh, I should exercise or I should eat healthier. If I had eaten healthier, I would blah, blah, blah. So again, storytelling, manageable units in the space of health. What can I do today? Yeah, maybe I want to climb Kilimanjaro, but I can barely make it around the block. And don't say I should be able to do something. Be kind and realistic about what you can do, what you want to do, and see if there are manageable units in the space of health that you can stay connected to
Mm-hmm.
and not only focus on the scary part of your existence. No
Awesome.
shoulds, no shouldism. It would
Yeah.
be simple.
When I
Yeah.
read the book, I was
Mhm,
like, ooh, catch
mhm.
yourself. That's
Yeah.
not a word you should be using.
Yeah, yeah. There it is again.
I know.
Guys in the group, I have everybody, call each other out. Oh, there it is again. So,
Yeah. I think we use it a lot. I've caught myself.
and it's an expectation of the mind to do something that you might not be able to do. So the mind says you should, doesn't mean you can or you won't. So if you catch that disconnect between should, want, and can, just eliminating the word or practicing to be aware of it and say, well, what can I do right now? And what do I want to do
Right.
is a big change in other parts of life.
And it sounds like there's less pressure when it's
Mhm. And
posed
that's
that
what
way.
ultimately should is. Should is pressure of mind. A whole other conversation.
Exactly.
Because the mind can be a bully and it goes back. Make your mind your friend. Use your mind for complicated decision making. You do need your mind for complicated decisions and scary decisions, but kind of tackle the bullying part of your mind.
This has been really special, incredibly powerful, and grounding. I love all the advice that you shared with everybody and bringing your expertise to this conversation. Much appreciated. And for those of you who are watching us and listening to us, if you're on YouTube, I'm showing Dr. Kogan's book, When Cancer Visits. It's an incredible read. I highly recommend it who are in it or know people who are in it. Where can people find you if they want to learn more?
Yeah, there's a website for When Cancer Visits. It's literally whencancervisits.com.
Okay. I saw you offer some workshops. I don't know if those are all in person or if you offer remotely.
Yeah, both. I also have a website. It's mdkogan.com. Has some
Wonderful.
resources.
Excellent. I will share all that in the show notes for everybody.
Mhm,
Thanks again. It was
mhm.
wonderful
Well,
meeting
thank
you and
you very,
spending
very,
time with
very
you.
much.
Thank you for being here today with my community. This is In Shock, a place where we don't rush past the moments that stop us in our tracks, but we learn how to sit with them, understand them, and move forward with intention and rise above it. If this conversation brought you even a moment of calm or clarity, consider sharing it with someone who might need it, whether they're newly diagnosed, in treatment, or supporting someone that you love. I'm Teresa Baglietto. Until next time.